So hello and welcome to this webinar from JTech Medical. My name is Jeremy, and today we are going to be focusing and talking about the benefits of objective testing. JTech Medical is known primarily for measuring human performance, physical assessments, joint mobility, range of motion, strength assessments, things like lifting, grasping, pushing, pulling, all of those things. And we're going to be talking about using JTech products in particular to perform those assessments. We're going to talk about the benefit of doing them, the kinds of data points that you can get from those, and how they might be used in a clinical setting. Today we are going to be looking at the JTech North Star software. You're looking at the main menu of the program right now. And for those of you who have attended some of our webinars and presentations in the past, we will be kind of skipping over some of the basics and talking more specifically about some of that data that you're going to be able to collect. So we are going to talk today about the objective testing portion of the software. I'm going to skip over to the testing area of the program. We're going to use a patient named John Doe today, and we're going to perform a follow-up visit. So we're going to kind of indicate that John Doe is here for a serial reassessment of his physical performance. We are in the testing portion of the software right now, where you can choose from among any number of subjective physical exams, neurological pain assessments, and things like that. We're going to focus today on the instrumentation, the devices in the software. And we're going to pick a few of these from among the available kinds of tests in the software: range of motion, goniometry, grip, and pinch, and some of these things. We're going to go ahead and select some of the things that are typically known to be a little bit more subjective, and we're going to talk about the benefits of measuring and observing those kinds of things. So we're looking right now at algometry. Algometry is a method of assessing someone's pain tolerance or pressure tolerance thresholds. We have a mannequin here with some anterior and posterior trigger points. Those come from Fisher or from the American College of Rheumatology, depending on which trigger points you're looking at. And we can simply queue up a few of these. And here we have a few that are sort of known as fibromyalgia trigger points. We also have some pressure threshold tests in general, so we can choose things like the deltoids, levator scapulae, and of course that queues those up over on the left-hand side here. And we'll just go ahead and use these as an example. We'll also choose to do some, let's do some strength assessments as well. I'm going to go ahead and choose a muscle strength tester, and here we have again a mannequin where we can choose different regions of the body, like the shoulders, let's say, shoulder flexion and extension. We'll pick a couple of those. And then we've got some joint mobility tests. Classically, the range of motion of the spine is a very common type of assessment, and we're very well known for that here at JTech, doing the dual inclinometry methods of assessment. And we'll take a look at maybe some of these, maybe a lumbar test, and maybe even some validity tests as well, and we'll talk about how those work. So we have now on the left-hand side of our software a fairly comprehensive little list of tests that we're going to perform today, and we'll just go ahead and begin with those. So the first test in the list is the algometry test. On my screen, my software is asking me to activate my algometer. It wants me to zero the device. I'm going to go ahead and do that.
Algometry, pain threshold, deltoid, left side, rep 1.
And here we are in the algometry test. So algometry testing is essentially taking an instrument that measures force and applying a uniform increase in pressure or in force over that surface area on a particular portion of the body, a particular trigger point or a particular area of the body. So in this case, we've got a deltoid, or sort of mid-deltoid point, and I'd like to take a look at the video that demonstrates how this test is performed. So up in the top right-hand corner, we have an icon that looks like a video camera. We're going to go ahead and take a look at that.
With subject supine and relaxed, place algometer perpendicular to skin over mid-deltoid. Tell subject, I am going to increase pressure slowly. Stay stop and click the switch when you begin to feel discomfort. Apply pressure at a rate of 1 kilogram per second and end the test when the subject says stop.
All right. So essentially, we take the algometer, as you saw in the video, we apply it on the trigger point in question, and we start to apply force in a uniform manner. There are a number of things when it comes to pain that are typically regarded as subjective. Asking somebody, the pain scale, the visual analog scale, how much does it hurt on a scale of 1 to 10, typically relies on the patient's self-assessment of the pain. There's not really a benchmark other than simply accepting the patient's statement of their level of pain. And it makes it very hard to progressively assess the efficacy of your care. That's one of the big benefits of being able to objectify data points like that, is that even with something like pain, which is traditionally, even at best, poking the person and saying, well, did that hurt? Well, yes or no. We now actually are able to tie a data point, an actual numeric value to that point, and identify where is the point at which that patient observably, by their reckoning, the minimum point of pain or of discomfort. So that allows us also to compare to population normals. So if you look down at the bottom, we have here normals for the left and right side. Some of those are going to be based on gender, as they are with algometry. You might have some that are based on age, such as grip strength testing, and we'll talk about some of those in just a little while. And then objectifying that data also allows us, as you can see up here,
right
to
side,
look at
the
left and
Rep
right
1.
side comparisons, and we'll be able to see that come through the data in just a moment. So I'm going to go ahead and start applying some force, and I'd like you to look at the graph area in the middle as I start to apply this to the patient's deltoid. We'll go ahead and start to increase force gradually here. And it's a little hard to see, but there's a second blue line that is rising here. And the guideline, so
left side, rep 2.
when the patient reports that painful response, we simply release force, or we produce a hand switch with which the patient can simply trigger, use a thumb trigger to indicate the onset of pain, and really, really nail down that, that immediate point of discomfort, that immediate point of pain, and that's able to be captured here in kilograms, which is the standard. The standard value is metric. You could also change it to pounds or even to newtons and get a very, very fine read on that. But as I mentioned a little bit earlier, that blue line also assists as far as objectifying data or making it as objective as possible in ensuring that force is being applied in that uniform manner. So as I apply force, the goal is that line, in this case, represents an increase in force of 1 kilogram per centimeter per square second.
Right side, rep 1.
Per square centimeter per second. So here we are able to even compare what we got for the first one, the maximum point that they reached before they felt that pain, 7.7, and then 7.4, which actually I guess we would think of that as the minimum. And we're able to identify just purely on that left-hand side what was the maximum force, what was the average, and then we have statistics like coefficient of variation, which help us to identify how consistent was that data, how reproducible was that data, how internally consistent was that reading, which gives us another point by which we can validate that data. So we're now testing the patient's right side, and again, we're going to go ahead and apply some force here. And again, the patient is either going to verbally let us know or push the thumb trigger.
Right side, rep 2.
And in this case, their right side is a little more tender than their left side. And that is useful because in many cases, in the case of an injury, you may not have bilateral injuries. You may have a unilateral tenderness. And you can actually use the patient's opposite side as sort of their normal value. I'm going to go ahead and apply again for our final repetition.
Algometry, pain threshold.
All right.
Levator
now we're going to go
scapulae.
ahead and take a look back
Algometry,
again.
pain threshold, deltoid.
We're going to take a look at the data that we've collected here from the deltoid. So we can actually see our repetitions up here on the left. We've got our left side, rep 1 and 2, and then our right side, rep 1 and 2. Down at the bottom, we have all of our results. So we have the max for the left and the right side, the average. We have the coefficient of variation, which I mentioned a little bit earlier. CV, as it's called, essentially represents standard deviation divided by the mean. It's essentially how consistent, how reproducible, how similar were the results that you got over the course of multiple trials. So since we have 2, we're able to compare. And CV being very low, normally CV as it's expressed as a percentage, the higher it gets, the more deviation there is, the more spread in that data. Cons is short for consistency, so it just lets us know, are they within the generally accepted threshold? CV, typically as soon as it hits 15%, is sort of understood to be a little bit too spread out. There's a little too much variation there. So CONS, cons, consistency, yes, it is consistent. And then here's one of the very first points, aside from just having values, here's one of the very first points that we can use measurably here to make some decisions about the course of the patient's care, the bilateral difference. So in this case, the patient's right side was 2.1 kilograms more tender or lower in threshold than the patient's left side. So if you find that there is a clinically significant value that's been identified here, you could use that as a goal in the patient's treatment and say, well, we want to try to bring your sensitivity threshold down to, or rather up to, the level of your normal side, your uninjured side. Down below in the bottom section here, we actually have normal values that have been established, again, by gender, for the patient's gender. Normal is 7.3, which we can see is in line with what we got for our left side. You know, anything above that's generally considered normal. And then there's a cutoff value, which is 5.1. So in this case, the patient is actually above the lowest sort of normal cutoff. But again, we can use the difference to kind of make some decisions. And that's the idea of objective data generally, is giving you, the clinician, information, actual data points with which to make decisions. Is there something clinically significant here? How does it compare to our previous examinations? Are you making progress based on the treatment plan that we've been following? And those are the kinds of things that you can get from that. So there are other algometry tests here. I'm going to jump down further in the list, and we're going to take a look at some strength assessments as well.
Muscle tests. Shoulder flexion. Left side. Rep 1.
All right. So in this case now, we are doing a muscle strength test. So previously, we've been looking at algometry as a measurement of tenderness, taking something that's very subjective, like pain, and being able to start adding some value to it, assigning some value to it based on performance and observed testing. In this case, strength is a little bit the same. We're still basing this on force, but we're looking at it more from the patient's performance and the ability to exert force against a muscle strength tester. This is sort of commonly understood to follow, it's the logical progression of something like the Daniels and Worthingham's muscle testing, or some of the standard muscle testing that you may be familiar with, doing that by hand. Hand muscle strength testing as a practice, you know, for somebody who has a feel for it, even an experienced muscle evaluator, they actually did studies on this in the last 10 years or so, and they found that even an experienced manual muscle tester by hand, using just the feel of the hands, would be, there is a possibility to miss up to a 50% left to right side difference in strength, because, you know, the human limb, we just don't have the ability to quantify stuff. We are still very subjectively oriented. Yeah, that feels like a lot of strength to me, or no, that feels reduced. But without having a data point to pin down, it ends up basically being essentially an opinion by the evaluator. So we're going to take a look at the video for this test as well.
Subject is seated with shoulder flexed 90 degrees and elbow straight. Stabilize shoulder and place transducer proximal to elbow joint on lateral surface of upper arm. Provide isometric resistance while subject attempts to flex shoulder. Tell subject to push, 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 relax.
All right. So in this case, you can see that this isometric form of testing, where the examiner simply holds the muscle tester stationary, the patient then exerts force fully with whatever the particular involved joint is, or the muscle, in this case, the shoulder. So we're looking at your deltoids again. I guess we're all about deltoids today. And the muscle strength gauge will capture that force in terms of pounds or kilograms. In fact, we did kilograms before. We can change it to pounds if we want to. The North Star software adjusts on the fly and does any conversions that are necessary. It preserves those data points. And then that value is simply captured in the software. So we're going to go ahead and, just as we saw in the video, we're going to have the patient exert some force with the left shoulder upward against the transducer. And then we tell them to push, 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 and relax. Verbal encouragement.
Left side. Rep 2.
Verbal encouragement, being very clear with instructions. There are definitely best practices when performing objective assessments, making sure the patient is familiar with what it is that you want from them, what kind of performance you want, making sure that they understand fully the nature of the test, perhaps even giving them a little bit of practice so that they can understand and give you the best results. All of these things definitely contribute to making sure that the objective data is as clean as possible, trying to eliminate any additional unnecessary subjective factors. So here we have a patient who has given us, again up on the left, you can see 27 pounds, 27 and a half, something like that. So that's the peak force from the line, the curve that we've got here. Our settings right now tell us that we're going to do 3 repetitions. So let's go ahead and add a second repetition. We'll ask the patient to flex up against the muscle tester. And push, 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 and relax.
Left side, rep 3.
And again, we've gotten a value of 28, which 28 and a half, so it's pretty close, within a pound. And again, that's the peak force compared to the peak of the other. And one of the things that's kind of neat about some of the computerized testing from JTech is that you can actually see the force curve, the actual line, the application of force over time, which in and of itself is an objective data point. You can actually read the force curves and see things like cogwheeling or fatigue, or perhaps even you can kind of read from the muscle test over the course of successive trials and find out, well, this patient started out very quote-unquote weak, but increased force over time. That actually could be a sign that the patient is guarding from pain, unsure about the pain threshold from doing a muscle strength test, and finding out that they can actually do a little bit more. So we're going to go ahead and do our third and final repetition for that left-hand side. Tell the patient to push, 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 and relax.
Right side, rep 1.
And I want to point out again down at the bottom that we've actually started to capture some results, some actual final calculations here. We have our maximum value. Again, typically you want to know the patient's best effort, their highest threshold, those kinds of things. On average across those repetitions, 28.4 pounds. Again, CV, coefficient of variation, still used for strength testing, and we can still see that that number is very low, indicating, and again, you can visually see it here. I mean, you can see that over the course of this 4 to 5 seconds that the patient really was quite consistent. Some variation, there will always be a little bit of variation, but overall the maximum values and the force curves over time seem to be really quite reproducible. So again, the consistency is going to show as yes. We don't have a percentage difference left to right side yet, but let's go ahead and try that now with the right hand side. And we tell that patient to push, 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 and relax.
Right side, rep 2.
And then once again, push, 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 and relax.
Right side, rep 3.
And then once again, push, 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 and relax. And here we have a situation where a patient we can actually see a reduction in their values over time. Recall from our last test with the algometer, also on the deltoid, that we had some some clinically significant findings on the right-hand side, a difference in pain tolerance. Here, we actually also see a reduction in force, perhaps from fatigue or from some other component, some other factor each time. And that is something that with just simply assessing someone with fingers and hands in kind of that old-fashioned manual way, you would not really be able to catch that over the course of successive repetitions. First of all, you wouldn't be collecting successive repetitions because you would give your assessment simply after the first resistance test or something like that. But here we can actually see when we were chasing coefficient of variation and saying, we wanted to be able to show consistency, show that we had collected multiple repetitions and therefore had a pretty good sense of the repetitions overall. Well, we can see that actually the coefficient of variation has jumped up to 19% for our right-hand side. And it's not that there was something that was necessarily invalid about the test, but it now brings me, the examiner, to look at the data and to find out, well, what am I going to do with this? Measuring objective data does not always mean that the data is going to go exactly the way you want it to. Objective data doesn't mean that all of a sudden all of your patients are going to be free from pain or free from complications or free from other factors. It gives you the ability to observe it and then to make some judgments about it and what is it that you want to do with this. So for example, with that 19% coefficient of variation, and we can see clearly that the patient is struggling over the course of successive repetitions to maintain force, that is a very important it's a very important characteristic to be able to see about their functional ability. In the real world, a deltoid or a shoulder that is hindered in that way is not going to be very functional. So we can see that there's absolutely some work that needs to be done on that to try to address those issues of fatigue. And we already know that there was a little bit of a pain threshold issue, so there's clearly some work to be done there. And in that case, you know, the evaluator could say, well, what are we going to do with this data? We could choose to perhaps throw out the lowest one. You actually can erase it in the software, but we can also simply deselect it or exclude it from testing. So if I take this bottom rep and say, well, it was the most fatigued, not necessarily the repetition that is representative of the patient's ability, but we're going to go ahead and click on exclude, and I'd like you to look at what happens down here to the arithmetic that's happening in our results. It takes that 19% spread, that 19% coefficient of variation that falls outside of the range, and says, well, now it's only 8%. And we can decide, you know, is that 20.8% functional? Is it not? Again, that becomes another data point. We're not only looking at the maximum ability for the patient, but we're looking at the patient's ability to sustain multiple contractions, multiple efforts over the course of time, and that could also be something that could go into the patient's chart or into the notes so that we could assess that for later. So that's another thing that can come from objective data as well, is not just the data points, and as we saw with the algometer, not just the application of force, but we actually get some extra data points here that we may not have even thought of before that might not have been open to us through a more subjective method. So we're going to save this, and we're going to jump down to some range of motion testing.
Inclinometry. Cervical flexion extension. Neutral.
All right. So range of motion testing, again, is something that is quite common, and at JTech Medical, we're pretty well known for dual inclinometry. We've made inclinometers for a long time, and our North Star software really carries on a lot of the abilities to capture those data points, and we're going to take a look at some of those as well, but let's take a quick look at the video for inclinometry testing and see what that's about.
Seated upright with head in neutral, place secondary over T1 and move it slightly to the side. In sagittal plane, place primary anywhere on head and press Enter to 0. According to motion default selected, flex or extend cervical spine and press Enter to record angle. Move to opposite position and press Enter to record angle. Continue for the required number of repetitions.
All right. So you may have seen an inclinometer test performed before, but of course there's two of these inclinometers. There's a whole method that the American Medical Association defines about how to capture that data. And that, I think, really highlights the idea of using measurement tools to perform those kinds of tests as opposed to using visual inspection. Visual inspection is tricky, especially with spine range of motion, because, for example, spine motion is compound motion. So where you might look at the top of someone's head or the tip of their nose to try and find out, well, how is their mobility? By using a second inclinometer to capture any movement, any recruitment, or any involvement of joints lower down the spine, it actually captures that. So, for example, let's go ahead and place some inclinometers on a patient. And we're going to zero them in their proper place, so up on top of the head and at the T1. We're going to zero those, and we're going to ask the patient to move all the way forward. And you can actually see, if we ask our patient to stay still for just a moment, you can actually see up at the top right the component parts of this. So we have 47, 48 degrees of movement, but 60 degrees of that is coming from the top of the head, whereas 13 to 14, maybe even as many as 15 degrees, coming from the thoracic spine or lower, which really by visual inspection would be essentially impossible to capture.
Extension.
And we're going to go back into an extended posture here. The patient's going to tilt all the way back.
Flexion.
And we're going to simply reproduce this test according to the AMA protocol.
Extension. Flexion.
And then one more.
Extension.
Now, we captured, I'm going to set the inclinometers down, we captured a fairly valid set of data. The American Medical Association for Spine Range of Motion has its own calculations, its own arithmetic that are performed for determining what they call validity, or we could think of it as consistency. By using objective measurements, we can actually know, and in the case of the North Star software, we can know during the course of the test, did we meet the actual statute or the actual requirement by the AMA's reckoning for showing consistency in movement. In this case, it only took 3 repetitions. It may take more than that. It could take 4, 5, or 6 repetitions. It might even be, as far as contiguous or consecutive repetitions, you may not find that it's rep 1, 2, and 3. It may be 2, 3, and 4, 3, 4, and 5, 4, 5, and 6. And between the flexion and the extension movements, it may not even be the same repetitions. So by capturing specific data points, in the case of the North Star software in particular, it's not only capturing those data points, not only seeing those component values, which can be reported, by the way, but also during the course of the evaluation, having a good sense of, did you meet a particular requirement for being able to show consistency of effort. So let's take a look at some of the values that we got here. In this case, we have maximum values for both flexion and extension, averages, and then deviations. Valid sort of takes the place of coefficient of variation. That's by the AMA's terminology. We also see here history. Now, for this particular patient, I don't have any history, but one of the benefits of objective testing is being able to show over the course of time, how has the patient been improving, or have they been improving at all? And again, you may find, as we saw with our muscle strength tester, sometimes the results do not come out the way that you might hope or that you might expect, but at least you have those data points by which you can act, adjust or change your treatment plans, and then move on accordingly and really, really focus on the patient's well-being and on the patient's improvement. Not to mention that in a lot of cases, most third-party payers and a lot of medico-legal scenarios, and even the patient's own personal interest in their health, those things are informed by objective data points. And not only in the areas of algometry and inclinometry and muscle strength testing, but in a number of other arenas as well. And so that's something that JTech really focuses on in our products, and we just wanted to take the time during this webinar today to talk about that. And then, of course, this data would be carried over into any reports, any printouts. We have covered that material in some of our other webinars as well. But of course, all of this is very well and good, but the entire idea is that you can report that objective data with all of the calculations, with all of the comparisons of history, with all of the clinically significant findings against normal data. All of that stuff is made possible by objective data. JTech does make a number of other products as well, in addition to our North Star product. You may find on our website our Commander Echo product line. Doesn't have quite all of the same features as you might see in our North Star product, but the idea of capturing objective data is essential in the medical market these days. You just can't get by anymore with a subjective opinion on a lot of these things, especially where we're talking about biomechanical things, joint mobility, strength, pain. Those things really do need a more data focused approach in order to give you, as the clinician, the information that you might need, to give the patient the information about their own wellness and their own progress, and to give third-party payers and other entities to whom you are beholden the information that they need to continue authorizing care or to pursue treatments through your practice as well. So think about that. Think about the differentiation that objective data can have for a clinic versus a clinic that doesn't have one. Help yourself to stand out among the crowd. And if you have any questions for JTech about how objective data can help you in your particular scope of practice, in your particular focus, in your particular arena, of course, all of these things can be applied in a number of ways, and we've got a team of people here who are more than happy to help you out. If you have any questions, find the chat widget on our website over at jtechmedical.com. You might see it down in the corner if you're watching this on our website now. You can also find us on the internet, jtechmedical.com. Our phone number, 1-800-985-8324. Please feel free to give us a call, and you can talk to a representative here about how all of these things can apply to you personally. I want to thank you very much for joining us for our stream today. Hope you have a great day, and we'll be talking to you soon. Thank you so much.